No more stiff person syndrome. Stiff person syndrome is a rare autoimmune, central nervous system disease that affects only 1 per million people. This disease mostly occurs in adulthood, and 60% to 80% of patients will have anti-glutamate decarboxylase antibodies in their blood and cerebrospinal fluid. If the nervous system is damaged by the antibodies, it may lead to central nervous system depression. Insufficient function causes the muscles to produce excessive activity and become stiff. Which group is more likely to suffer from stiff person syndrome? Women are twice as likely as men to suffer from stiff man syndrome. And this disease often coexists with other autoimmune diseases, such as type 1 diabetes, also known as insulin-dependent diabetes, thyroiditis, vitiligo, pernicious anemia. In addition, some patients with stiff man syndrome may be related to malignant tumors. Clinically, breast cancer, colorectal cancer, Hodgkin's lymphoma, small cell lung cancer, pharyngeal cancer, mediastinal cavity tumors, thymoma, etc. have been reported. What are the signs and symptoms? Improper balance of steps, unsteady walking, easy to fall, muscle stiffness, muscle spasm pain, such as back pain, behavior changes, slurred speech, sensitivity to noise and emotional stress, causing muscle spasms, epilepsy, brain lesions. The main symptoms of patients with stiff person syndrome, as the name suggests, are that the trunk and limbs will become stiff, tight, and feel as hard as iron, especially in the muscles of the abdomen and lower back. When the limbs are also stiff, walking and activities will be limited. Stiff person syndrome attacks come in waves. Perhaps just hearing a loud noise or being touched by someone else, the patient will have muscle twitches, often starting from the abdomen, and then the face will twitch, making people think he is making a face. Long-term muscle twitching in patients can cause pain all over the body, and later lead to body deformation, scoliosis or hunchback. Patients often dare not go out because of fear of attack, and suffer from depression and anxiety. May be confused with Parkinson's disease and motor neuron disease. Stiff person syndrome is called a syndrome because the symptoms are similar to those of other diseases. It can easily be mistaken for Parkinson's disease, Tourette's disease, multiple sclerosis, restless legs are commonly known as ALS, of motor neuron disease.